Hi YouTube family, welcome to Concept in Medicine. And guess what? We are going to be looking at a simplified concept regarding the male and the female pelvis. So in short, the female pelvis versus the male pelvis. But before we move on, kindly subscribe to keep the channel running. Okay, let's move on. So we are going to be looking at the differences between the male pelvis and the female pelvis. So in a tabular form, as you can see, the female pelvis is broader and the bones more slender than those of the male pelvis. That's the first difference. The second difference will be in relation to the pelvic brim or inlet. So the female pelvic brim or inlet is oval shaped transversely and widest forward. But if we take a look at the male pelvis, the pelvic inlet of the male pelvis is heart shaped and widest to the back. The next one is a cavity. If you take the female pelvis, the pelvic cavity of the female pelvis is more spacious, but that of the male pelvis is less spacious. And the next one you should know is the Sakura Promontory. If we take the Sakura Promontory in the female pelvis, it's less prominent, but in the male pelvis it's more prominent. Then finally, the subpubic angle. If we take a look at the subpubic angle of the female pelvis, it's more round, meaning that it's approaching 180 degrees, meaning that it is greater than 90 degrees and looks like the Roman arch. So this is the Roman arch, as you can see, it's round. But if we take the subpubic angle of the male pelvis, it is more acute, meaning that the angle will be less than 90 degrees. And it looks like a Gothic arch. Look at the Gothic arch. It's looking as if it's pointed. So you can see that that angle is less than 90 degrees. I hope this clears your doubts about the differences. Kindly make sure to subscribe, share, like, and comment the next concept you want to see on my channel. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.